So we're going to be going over hypovolemic shock.
So what is it? It's a decrease of circulating blood volume. So fluid in the cells, there's intercellular fluid and extracellular fluid. So the fluid in the intercellular space is in the plasma, and the fluid in the interstitial space is extracellular fluid. In a healthy person, the amount of fluid in the intercellular and extracellular spaces are relatively constant, but water and solutes, such as electrolytes, move among the compartments to maintain a homeostasis. Fluid intake and output provide a rough measure of homeostasis. They must have approximately equal to each other to maintain balance. When there is a low blood volume, it causes a drop in blood pressure and a drop in the amount of oxygen in your body because the heart is not able to supply enough blood to the rest of the body and vital organs. How does a person get it? It can get it by an internal fluid shift. So this is like internal hemorrhage. Fluid is accumulating somewhere else, causing an imbalance, such as in the hemothorax, ruptured spleen, or a long fracture of the bone. And external fluid loss, this just means that you are losing fluid from your body, such as vomiting, diarrhea, and the rest listed there.
How is the diagnosed history of what could be causing it through a also physical examination, and then some lab tests are the complete blood count, which would include red blood cell, white blood cell, hemoglobin, and hematocrit. So a high red blood cell count would indicate lack of enough water or fluids from the above causes. High platelet could indicate bleeding, bone marrow problems, or iron deficiency. The electrolyte levels, just your typical electrolytes, lactate levels, prothrombin time, the time it takes for your blood to clot, and then the arterial blood gases, which is the level of oxygen and carbon dioxide in the blood. So, for example, your pH, your partial pressure of oxygen, partial pressure of CO2, base excess. So pH should be around 7.35, 7.45. And there's different severities of the injuries. It goes from stage 1 to stage 4. I'll just kind of contrast stage 1 and stage 4. So stage 1 is loss of up to 15% of the total blood volume. We'll have a normal or slightly low blood pressure, and they'll have normal mental status, respiratory rate, urine output. And contrasting that with stage 4 injury severity would be loss of greater than 40% of total blood volume, extreme tachycardia with a weak pulse, extreme tachypnea, unconscious, coma, and they'll have very little urine output.
So how does it affect a person? So it reduces the preload and stroke volume, which causes a decrease in cardiac output. There's an altered level of consciousness, agitation, restlessness, hypotension, tachycardia, and loss of fluid to vital organs such as the heart and brain mainly, but also to the liver and spleen as well.
The prognosis of this condition, is it a medical emergency? So delayed treatment can lead to organ failure such as myocardial infarction, brain damage, kidney damage, gangrene, coma, death. So the faster you can identify this and start treating could potentially save the patient's life. Some prevalence, including characteristics. This is more of a incidence due to something else, so there's no prevalence statistics. There were over 1 million patients that presented to the emergency room in the United States with shock each year. It costs about over $100 billion, and it can affect any age or gender. They found that the youth were more likely to get this from severe burns, and adults were more likely to get this from severe blood loss due to accidents.
Medication and treatment. So addressing the underlying problems such as stopping the bleeding. preventing hypothermia. Since there is decreased oxygen flow in the body, the person can't maintain proper body heat, so it's important to keep them warm during this. Fluid replacement, such as with an IV, such as crystalloids, which is like sodium chloride would be an example, or colloids, such as albumin. Blood transfusion, blood or plasma can be used in some cases to help with this, and all these are, you're wanting to restore the balance of intracellular and extracellular fluid, but you don't want to overload the volume system because that can cause problems as well. So one of the studies that we found was using ultrasound to detect early phases of hypovolemic shock. The ultrasound was over the inferior vena cava and abdominal aorta and measuring the diameter of each of these. And they had 52 blood donors they evaluated and did ultrasound before and after their donation. And 3 readings were taken, and the mean value of these were recorded. And overall, they found an index below 1.14 indicated early stages of the hypovolemic shock. And then another study was a case report, and a 67-year-old woman was in a motor vehicle accident and brought into the ER. And a CT revealed she had a dislocation, a fracture of L3, L4, but there was no signs of trauma to the abdominal cavity, so there wasn't any bleeding or anything. And while she was in the ER, she was conscious and stable. But however, the blood pressure and mental status soon deteriorated, and so they found soon that her third lumbar artery had been ruptured due to the L3, L4 vertebrae fracture. And surgery was performed in endovascular embolism, so that is kind of what we learned about in class last semester. Like with strokes, they have like a coil that goes in and it wraps around the hematoma to stop it. And the patient gradually improved after surgery, so the study just shows while most of the time like the abdominal arteries and organs in the abdominal cavity has hypovolemic shock, it is not always the case, and it can be seen anywhere in the body and needs to be treated rapidly and after signs and symptoms are seen.
So for the health assessment, discriminative to see if the patient has it or not would use the complete blood count test, electrolytes, urinalysis, clotting time, arterial blood gases like I listed above, and then evaluated to figure out the severity. Remember that stage 1 through 4 by the clinical measurements taken from examples provided previously in the slideshow. Then here are sources, more sources.